It was a huge study on adverse childhood experiences. And they said the more adverse childhood experiences that a person has, the more likely they're going to have some type of addiction. These are adverse childhood experiences. You'll hear people talk about them as ACEs. Witnessing domestic violence. That's just one, right? And then maybe they have a parent with a mental illness or a substance abuse problem. Parental separation and divorce. Living with a household member that's incarcerated. I just mentioned a few. These are some of the most common ones. But there's a long list that can it's something that the child experiences when they're young. It negatively impacts them, and they are subconsciously looking for a way out. They're looking for a solution. And the first time they feel good about doing something, they can rely upon that thing, especially when it comes to internet usage. They rely upon it, and it becomes the crux. It becomes the coping mechanism. It turns into an addiction. Okay. Of course, trauma, an overwhelming event. I told you about Umar ibn al-Khattab radiallahu anhu. I told you about Uhud. Those are overwhelming events. It's traumatic. But don't forget about not receiving what you need. If children don't receive what they need, that is a type of trauma. Consistent bullying is also trauma. We call it small t. It's a small t, but it's still trauma. Okay? Children need acceptance. They need approval. They need love. They need a lot of love. And if they're denied that, the need doesn't go away. It's just going to morph into some other dysfunction later on in life. They're going to try to expect everything from their spouse that they didn't get from their parents. And then the spouse is going to say, hey, I can't be your everything, right? Nobody is designed for that. You need the family, you need the community, you need the spouse, you need all of these different factors, right, to take care of a person. But if they don't receive it from their family or their caregivers, then it morphs into their friend circle. And then the friends start saying, wow, she's really needy. He's seeking power all the time because he never had the autonomy when he was young. So now he's trying to get it in the masjid. He wants to be the one who always calls the adhan. He lets somebody else call the adhan, he's going to have a fit, right? And we don't even realize, oh no, this has to do with his youth. It's not really about the adhan or the masjid. It's really about he didn't get what he needed when he was young. Okay? So that is the neglect of necessary needs. And this is a big one. And I would encourage you to look into this a little bit more, because this is the one that affects our community the most, I believe, which it's called dislocation. There's a good book, really good book. It's dense, probably take you a few months to get through it because it has thousands and thousands of footnotes. But it's called the globalization of addiction by Dr. Bruce Alexander. Remember Rat Park? Anybody heard of Rat Park? Right? It was a study done on, they put rats into a cage. They made one really, really nice. They made one really, really terrible. And they put cocaine in both, right? The rats that were in terrible conditions always went to the cocaine. The rats that were in good conditions hardly touched it. And then they said, oh, there's something here. When even rats, if they're in terrible conditions, too many people, the mating conditions are not good. There's not enough food, not enough water, all this stress everywhere. The cats circle the cage for the stress. They go to the cocaine, the water with the cocaine in it. They need the dopamine hit. But if you make it nice and wide, and he's the one that did that study. It's a beautiful study. And then he brings in the Native Americans, why they have the highest rates of diabetes and heart disease and alcoholism in the country. And he says it's because of their dislocation. They have been torn from their culture and traditional spirituality. And that's a lot of times what I see with our youth, is that they have this background, right? They're from Pakistan, they're from Bangladesh, they're from, Jordan, they're from Syria, but then they're thrown into this and they're told, go to school. And then they go to school and they have to be somebody different at school than they are at home. They become dislocated.